Welcome to the Clinton County Outreach. This will be our second year in Plattsburgh, New York, which is the county seat of Clinton County. Clinton County is situated in the northeastmost corner of New York State. It's situated right along the Hudson and the Canadian border. Plattsburgh is the county seat and is the largest city in the county. It is also really the only major city in the county. A lot of the surrounding area is quite rural, and that's you can tell by the size of population. So the county is about the size of Rhode Island, and the population is substantially smaller than that of Rhode Island. So when we're talking with patients and we're thinking about kind of how far they've potentially traveled, just think about literally how far they have traveled. We had people last year who traveled close to 2 hours to get to the clinic, and we had people who came over the Canadian border because there is no dentist, no dental care like at the border. They'd have to go like up close to Montreal. And so it's a really interesting place. For a little background on the program, we were invited last year by United Healthcare's Community Plan, which is their managed Medicaid plan in the North Country, to provide services to their members. The marketing team, actually, ironically, was the group who looked and realized they had about 1,200 members, only half of whom had seen a dentist in the last 12 months or longer. And so they kind of thought to themselves, why do we have all these people who have this coverage but aren't actually using the services? And they realized it was because there were not enough providers in the area who accepted their plan. So they reached out to us and said, hey, can you guys provide these services? You can bill our members. And this way, not only are they doing good for their members, but they're also actually being able to use the services that they offer. So we will be going up with them again this year. They will be on site with us. And I just like to point this out just because most of us don't think of health plans as being, and insurance companies as kind of being stalwarts of the community and of being these kind of protectors of their population. But United Healthcare has, in fact, done that in the North Country. So one of the big things that we talk about as kind of the Office Global Outreach is public health. And we want to help you guys think in a very public health minded way. So one of the things we talk about are the social determinants of health. The social determinants of health, the WTA defines as the conditions in which people are born, grow, live, work, and age. And it's the whole idea that you and your health picture are a byproduct of all of these different factors. And as you can see on the pie chart, it's a combination of genetics, social circumstance, environmental factors, healthcare, and individual behavior. So that's kind of the difference between whether you live on a farm in Iowa or in a smog-filled big city. It's the difference between if you have access to care or if the nearest doctor's office is an hour and a half away. And then when you think about individual behavior, it's really possible, or it's very kind of general, to blame people for the choices they make. But it's really important kind of when you're thinking about the social determinants of health that people's individual choices and individual behavior are shaped by their surroundings and by kind of their upbringing and by all of these other factors. So my ability to go out and make the choice to have a salad for lunch is based upon my, not only the knowledge that the salad is the better choice for my lunch, but also based upon the fact that I have the time to go out and get lunch and can't afford to buy a fancy salad in New York City. And kind of all those factors based versus the person who you can talk to a homeless person about dietary guidelines and nutritional facts all day, but that doesn't mean that they're going to be able to make the decisions that actually support that kind of learned information. So it's really important to kind of think through that people's lives are not just a kind of direct responsibility of their own, but are rather so much of everything around them. And to kind of tie into that, one of the things that we also like to think about is the health impact pyramid. So we always think about, people say that education is the key to improving people's health, because the more they know, the better choices they can make. But again, as we just talked about, that's not necessarily true. So as we like to think about here in New York, if a dentist meets with 10 patients a day and has chairside education with those 10 patients a day, that's 10 people in a city of 8 million. Whereas if we can kind of go down the pyramid and have a larger population impact with less individual need of effort, we will have a much greater change in kind of the broader group. So we always want to look to changing kind of bigger things. And a lot of these are not something that you as an independent person can do, but it's something that you can advocate for. You can lobby. A lot of it are kind of governmental changes that need to happen in terms of adding fluoridated water into everyone's water supply and regulating snack supplies so that people's kind of default decisions are the healthy decisions. So when you go into a store, the first thing you see is fruit and vegetables and isn't the chip and candy. And then it's really going down and looking kind of the socioeconomic factors that are kind of at the crux of all this issues. And that is really the idea that if you change, if people have limited income, they only have so much ability to, they live paycheck to paycheck, they can't think about kind of their health in a broader picture, in a potentially preventative manner, because they're only reacting to things. They don't have the ability to have that foresight that comes with a healthier life. And the reason we talk about this, especially in this context, is that we do community-based experiences. So part of our program has all of the students going and leaving clinic for about an hour at a time to literally step outside the teeth and to interact with the community and community agencies to learn more about the community and what these different agencies are doing to support the population and their needs. So all the students will get out of clinic at one point during the week, and then there is a bit of a write-up that has to happen, and that's basically you not only kind of doing the description of your CB, but also doing a reflection of what did you learn, why did it impact you, and what might other people be able to learn in the future. Now for a bit more of the logistical details. For those traveling from New York, we will be leaving on Friday, September 27th, departing at the NYU College of Dentistry, 433 First Ave at about 8:30. So that means get there at 8:30. We will pack the bus and then head out. If you are late, we will leave you behind, and you don't want to do that because then we'll all hate you for the rest of the trip. Just kidding, but don't be late. It is about a 5-hour bus ride. We'll stop for lunch on the way, but just prepare to be comfortable. For where we're staying at the Hampton Inn and Suites. This is a very luxurious outreach. So for those of you who have been on outreach with us before, it's definitely a change of pace. There's a pool, there's a fitness center, there's hot breakfast every day. So know that it's going to be nice, but you also will have limited time to take part of those kind of perks. We will be leaving from clinic on Thursday, October 3rd, and we'll be returning to the college anytime between 10 p.m. and 2 p.m. It kind of depends upon how quickly we pack up and if we hit any traffic on the way home, so don't make any dinner plans that evening. For the week, as you can see, this is the schedule. Friday is a busy day. We leave the college at about 8:30. We arrive in Plattsburgh more or less about 3 p.m. We have a meeting with the mayor at 4 p.m. to do a welcome to Plattsburgh and to learn more about the socioeconomic, political, cultural climate of the community. And then we will do an Axiom training session back at the hotel before dinner that evening. A couple of key points about this. While we should have some time in between the arrival and meeting with the mayor, we may not have enough time for people to shower and change at the hotel. We may just be able to drop bags and hop right back on the bus. So if you're very concerned about your appearance in front of the mayor, just keep that in mind for what you wear on the bus, or if you bring something in your bag for a quick bathroom change. But you don't have to be fancy. You recognize they'll be coming off the bus ride. Saturday morning, we'll be getting up early. We'll be leaving the hotel about 6:45 in the morning to head to clinic to set up the space. We will then run clinic from the time we're ready to go through, we'll check our last patient in about 5 p.m. So if there's an endo procedure that starts at 4:30, people will be in clinic until 6:30. So just be prepared for a very long day. At the end of every day of clinic, we do a debrief. We send a big circle and we chat about the day. People share their experiences, their patient stories. And so time for us to kind of learn more about what's going on in the community. And then we have dinner. And that's the schedule pretty much all week for while we're in clinic. The deviations of this are Monday evening after dinner, there's an optional ghost tour. If you are not interested in the ghost tour because you're scared of ghosts or whatever, just email me and let me know. My contact information is at the very end of this, or just respond to this email. And then Tuesdays are a day off. We will be sleeping in a bit. And then we're going to kind of do like a stereotypical fall day in the North Country. So we'll go apple picking in the morning. We'll go for a hike / walk through the woods in Ausable Chasm, which is really, really beautiful. And then we'll head down to Lake Placid for a couple hours of free time and dinner down there. That's really the only free time you'll have the rest of the week. As you can see, we run a pretty tight schedule, and you will be exhausted. I say that clinic week is the best sleep you'll get during dental school, and most people agree with me. So just be prepared to be tired but very fulfilled at the end of the week. So in terms of everyone's roles and responsibilities, the thing that we like to focus on is the fact that students are the primary providers in clinic. So as you can see in the photo, there's a student on the right, there's a faculty on the left. The student is the one who's there doing the work. The faculty is there to provide guidance and leadership, to make sure the student's doing it right, to teach, but not to be the person who holds the drill the majority of the time. So the residents and faculty are there to support you as students, but know that you will be kind of driving the ship. With that being said, we're a group of 38 people. We're a pretty big group. And if we all work together, we'll get things done really quickly and efficiently. But if half the group is just sitting on the side, kind of twiddling their thumbs, checking Instagram, not working, it means the other half of the group is working that much harder to get things done. So we want to be sure to just be really mindful of that, to work together, to take an active part. While there is a maid at the Hampton Inn, there is no maid in the West Side Ballroom. We'll be having clinic. So we want to be sure that if you see an overflowing trash can, don't assume someone else is going to take it out and put a new bag there. So if you have a moment, do that yourself, and we'll point out kind of all those details when we arrive at the ballroom on Saturday morning. At the end of every day, we clean up stations. We don't pack up by any stretch of the imagination, but we do kind of do a reset. So just know that when your last patient leaves, that doesn't mean that you are free and clear to go at the end of the day. It means that you're kind of there to like help clean up and wrap up for the day. And then before we leave the West Side Ballroom, we do, as I mentioned, the daily debrief. We sit in a big circle, and it's a time for us to kind of chat and reflect upon the day and the week as a whole. Everyone should be familiar with Axiom. We will be using Axiom in Clinton County because we are in New York State, but it is a limited version of it. So it does not require faculty swipes. We'll be logged in under faculty profiles, and we will be doing a full training on Friday evening to ensure that everyone understands patient flow and the responsibility of both the faculty and the students. We also will be taking a number of x-rays in Clinton County because we're in New York State, and we'll go over that, but there will be 4 Nomads, which are portable x-ray machines, and we will be having them in triage, oral surgery, endo, and resto. And we'll go over kind of what is required on site as well. I will also be sending out student rotations in the coming days. All students will rotate through adult restorative and oral surgery. D4s and international comp will rotate through a full day in endo. D3s will be pulled in for one appropriate case. So it's generally a single canal anterior tooth. So get excited about that. And then a handful of people will rotate through triage as well. Triage is an opportunity to be kind of the first line of defense of the clinic. You'll be able to see and meet almost everyone that's coming through the door, which is a really great opportunity to hear a lot about their stories and more about the kind of medical complexities that you'll encounter in Clinton County. One student will also, or everyone will also be pulled out of clinic to go on a CBE at one point during the week. It's about an hour or so out of the day. If you ranked your rotation preferences on the participant information form, I took that into consideration and tried not to pull you out during your top choice. That does not mean that it is perfect, and I apologize. If you see something that is glaringly wrong, please let me know. But if you're just unhappy, I'm sorry, you can only do oral surgery once, and you can only do endo once if you're a D4 international comp. So those things can't change. I apologize. Our biggest aim during this week is not actually to see as many patients and to provide the best care, but it's to protect you as our participants. So the key to that is working at a comfortable pace and recognizing that the week is a marathon and is not a sprint. While on the first day, you're going to be super energetic and enthused and want to get as much done as quickly as possible and kind of just be super jazzed, you have to recognize that burnout is a real thing. And so we just want to make sure that you are taking the time to be mindful of your own well-being, because if you are not okay, you can't do any dentistry. So just keep that in mind throughout the week. I, as part of the administrative team, obviously cannot do the dentistry. So it's part of my job to make sure that you can do the dentistry. So I'll be walking around with water at different points. I'll be checking in, making sure everyone's had lunch, and just kind of making sure that like everyone's well-being is on point. So just kind of keep an eye out for that. I'm like a team mom. I will not be walking around with oranges and apple slices at lunchtime, but maybe one day I will. In terms of the safety of patients, you're going to want to make sure you review medical history with each and every patient. And even if you see a patient multiple times, you're going to want to just verify with them that nothing's changed in between visits. There is a lot of medical complexity in Clinton County. You will see a lot of obese patients. You'll see a lot of diabetic patients, a lot with heart issues. And so you're just going to want to keep that in mind and consult faculty throughout the process to ensure that you're understanding all of the potential counterindications throughout the journey. Our oral surgeon was out with us last year and became very familiar with a lot of the issues. So she is a great consult whenever it is necessary. Use caution with instruments and sharps. The same rules that apply in clinic apply on outreach. Use a single-handed scoop, etc. We'll review kind of best practices during our clinic orientation as well. Always ask for help from faculty. Never think while you are there as a student, you're there to be the primary provider. You're never there on an island by yourself. So be sure to lean on the people who are there to support you. If anything occurs, you need to stop working and notify your supervisors immediately. So whether that's a faculty or part of the admin team, just be sure to alert someone. We say if something happens, but really it should be when something happens. So we've had very unfortunate incidences that are never anyone's direct fault. We've had needles break off in gums. We've had burrs not latch properly into drills that go into someone's mouth and they accidentally swallow. We've had ortho brackets break off of teeth that aren't being worked on and get swallowed. So it's really important that we follow up with those individuals to make sure that they didn't aspirate something, to make sure that our patient safety is being well-minded. You will never be in trouble. We just want to make sure that everyone's kind of doing what they need to do to support the clinic as a whole. We also have a full emergency response protocol and procedures in place in case anything does happen. So know that your safety really is at the forefront of our thought at all times. In terms of what to bring, you'll need scrubs for 5 days of clinic. You will literally get up, change out of your pajamas into scrubs, be in scrubs all day, get back to the hotel, change out of your scrubs, shower, and go back into PJs. So for those days, I'm not kidding, you really just need scrubs. If you have loops, bring your loops. If you have loops, bring a charger for your loops. Don't assume someone else will have the charger. If you don't have loops, bring protective eyewear. If you have a headlamp, bring the headlamp. There is good light in the ballroom that we're situated in, but there's no portable light like there is in a normal dental clinic. So just keep that in mind. And you want to bring comfortable shoes. There will be a lot of standing. And so just keep that in mind. Personal items, the weather's a little far out at this point. So we can kind of check closer to when you're actually packing, but keep in mind that it's going to be a little bit chillier there than it is in New York City. For those of you coming from Buffalo, it'll probably be a little bit closer to what you're used to. But be prepared for chillier temperatures, especially in the evening. For the day off, I would definitely recommend layers. I'd also recommend potentially bringing a second pair of shoes in case the ground is wet. You don't want your shoes for clinic to get wet so that the next day you're miserable while doing dental care. Personal medications, we do bring a fully stocked med kit for the participants. It's not for the patients. And so if you end up getting sick, we definitely have things that will cover you. But if you have personal medications, just be sure to bring those. We do feed you 3 meals a day, including lunch. But if you know you need to eat every hour and a half, otherwise you become Oscar the Grouch, please bring your snacks. And you can definitely take a break for 5 minutes to eat your snack, to make sure you're drinking water, to take care of yourself during the day. Don't feel like, oh my God, there's a line of patients at the door. I need to just go. Again, you need to take care of yourself. And if that means taking a 5-minute break to eat a snack, do that. As I mentioned, it's also about a 5-hour bus ride. So I personally will be bringing a pillow and a blanket. It was very cold on the bus last year. So just keep that in mind as well. The patient image policy is the same on outreach as it is in your home clinic. So that means teeth are okay, faces are not. We've gone very creative at how to take these photos. As you can see, it's a great photo of people providing dental care, but of not actually showing the patient's face. That is not to say that you should not take any photos in clinic. Just be very mindful of how you're taking them. Here's a really great checklist before posting anything on social media. It's really just the idea that you don't want to portray someone from a patient with gauze hanging out of their mouth and trying to kind of victimize or portray them as the other, that you're doing some godly task by providing them this dental care. You always want to do so in a very mindful manner where you get consent from the patient to post the photo the way that we kind of think about is like you never want to share something of a stranger. So if you don't feel comfortable offering them the photo, sharing it with them, kind of like having them sign off on it, you shouldn't post it at all. And this is just kind of read through the checklist and be mindful of this. Marissa, who everyone will meet on site, is our social media guru. And if you ever have a doubt, she's the person to kind of check with. You also can look at our social media on both Facebook and Instagram as kind of the guide for how to do that. If you completed the social media consent form through the participant information form, we'll follow you if you allowed it. If you didn't, we will not follow you. But if you post something in Clinton County and Marissa searches Clinton County on Instagram and she sees your post and it's inappropriate, she will ask you to take it down. So just be very mindful of what you're posting. We are a group of almost 40 people traveling. We'll be in scrubs. We'll be eating out in town. We'll be very noticeable. So you don't want to do anything that puts yourself and the group kind of in jeopardy of our good standing within the community. But also be sure to share photos. We'll do a Google photo album. We also have AirDrop for iPhones. So we can share photos in case you get a group photo. We don't all have to take group photos. We can kind of take one and share it amongst the team. So don't worry about any of that. Just some quick details. All group meals from lunch on the bus ride up to Plattsburgh through dinner on the bus ride home from Plattsburgh will be covered by NOE Dentistry. You really only need spending money for your personal use for those couple of hours in Lake Placid on our day off or during apple picking. There's a really great store and a whole bunch of delicious treats there. So that's really all you need. Otherwise, everything's taken care of. And just the key is to represent NYU Dentistry and your profession as a future dentist or as a current dentist with the most upstanding behavior that you can. Anyone who's displaying unacceptable behavior will be sent home, which means that one of us from the admin team has to leave, and that will break our heart. So while we never want to have that happen, know that it is a thing. If you are late for the bus, we will leave you behind, and then you will get a talking to. Again, had that happen, we just want to make sure that everyone knows that while you are one person, we value your single contribution. As a group of 38 people traveling, we can't give preferential treatment to any one individual over the group. So just keep all those things in mind. And if you have any questions, here's my contact information. Feel free to text me. I'll have my phone with me all the time. You also have Marissa's contact information in case you need her, in case you can't reach me. If you have any questions, feel free to call, text, email, and I look forward to seeing everyone in a couple days up either waiting for the bus or in Plattsburgh. Thanks so much.